Good afternoon. My name is Kathy Allen, and this PowerPoint is about ensuring the Telehealth Expansion Act of 2021. So on March 6, 2020, President Trump signed legislation HB 6074, which was the Coronavirus Preparedness and Response Supplemental Appropriations Act of 2020. And this bill, HB 6074, provided a waiver for telehealth limitations by Medicare. During the pandemic, the government allowed for temporary expansion of telemed services that allowed for improvements in insurance coverage and reimbursement for the services to the providers. The current Telehealth Expansion Law, which allowed for easier access, increased billing options, and fewer regulations. That law is set to expire as soon as the public health crisis of COVID-19 is resolved. So this new legislation, HR 341, that's proposed regarding the telehealth bill, ensures the Telehealth Expansion Act. It was introduced on 1/15/2021 by Representative William Rogers of Texas, and the bill would make permanent several telehealth flexibilities that were initially authorized during the public health emergency relating to COVID-19, and particular concerning Medicare coverage of the telehealth services. The bill is not yet passed and was referred to the Subcommittee on Health in February of 2021. The telehealth and telemedicine often can be used, those two words, interchangeably. However, they do mean very different things. The World Health Organization defines telemed as being administered by physicians only, while telehealth describes services provided by a wide range of healthcare professionals, such as nurses, pharmacists, or other professionals. On the other hand, the American Telemed Association largely views telemedicine and telehealth to be interchangeable terms, encompassing a wide definition of remote health care, although telehealth may not always involve clinical care. For purposes of this PowerPoint, though, I'm going to be using the two terms interchangeably. Some more history on telehealth. People would say that it began when Alexander Graham Bell invented the telephone in 1876 because the telephone represented a new way for people to access medical services. But in the 20th century, NASA was actually the first federally funded program to use telehealth and telemedicine to monitor the health of the astronauts while in space. Federal and state lawmakers have strictly regulated telehealth, but the pandemic started a new revolution in telehealth care. So in 2020, to limit the transmission of COVID-19, telehealth universally became the choice for most healthcare providers, and the need for increased use of telehealth prompted the legislation on both the federal and state levels to loosen the tight regulations that were in place previously. Initially, telehealth was limited to specific providers, specific sites, and specific payers. Now, the temporary telehealth expansion laws are changed to allow almost all areas of healthcare to utilize telehealth technology, such as outpatient clinics, mental health, community healthcare, along with different providers like social worker, physical therapists, occupational therapists, and also you will see a lot of use in inpatient units. So, how is telehealth reimbursed? Currently, this is one big point of change from the past, and I'm going to highlight a couple of changes that started on March of 2020. So the CMS changed some of the Medicare provisions that allowed for coverage of office, hospital, and other telehealth visits and in patients' actual homes, and allows use of smartphones. It also extended the use of telehealth to new patients, because in the past, in order to use telehealth services, you had to have an in-person visit first. And also in March of 2020, the first Families First Coronavirus Response Act that provided increased funding for state Medicaid programs to provide telehealth services. Also in March of 2020, the Coronavirus Aid Relief and Economic Securities Act allowed telehealth distant site providers to furnish telehealth in home or other settings. In the past, telehealth you would have to go to a certain site in order to receive the telehealth services. So for people who were in rural areas, this new provision allowed a much greater access to telehealth. And CMS also decided to waive any requirements related to the telehealth services in regards to PHE. So they suspended the sequestration through December 31st of 2020. And in 2021, the COVID-19 pandemic, now as it's starting to decline and the laws and regulations that are put in place due to the public health emergency are beginning to be revised within the states. For instance, many states such as New Hampshire and Colorado have already passed laws to expand the telehealth coverage. This current legislation that is in the Congress, Bill HR 341, will ensure that Telehealth Expansion Act will continue to provide Medicare funding for the use of telehealth, and it is still pending in the Subcommittee on Health. It was brought before the House in January of 2021, and as of September, it is still in the House. And when they're talking about healthcare parity, that basically just means that we're allowing the same payment for an in-person visit as would be charged for a visit using telehealth. So what kind of changes are coming with telehealth that we've seen through the pandemic? It's very relevant, the changes to today's practice, because the expansion of services includes increased providers, so that some healthcare workers such as occupational therapists, speech therapists, and physical therapists are now permitted to be reimbursed for the services that they render via telehealth. In addition, patients and providers previously needed to meet face-to-face, as I said before, in an official healthcare service facility to be eligible for reimbursement. Now, both the patient and the provider are permitted to meet each other virtually in their homes. Services that are eligible for using telehealth modalities have expanded beyond general medicine and behavioral health services and now include physical, occupational, speech, dialysis, substance use disorder treatments. And this expansion also includes non-video, audio-only connection. Utilizing the phone could also be reimbursed if a provider phones a patient at the same rate for an in-person face-to-face visit. So as with face-to-face consultations, payment for telehealth service depends on the length and the complexity of the visit. And this slide is showing a graph of what telemedicine usage was prior to the COVID-19 pandemic and also during the pandemic. And as you can see, the telemed use has grown substantially. Before the pandemic, telehealth was growing annually at a rate of 18%. However, when COVID-19 began in 2020, telehealth users grew to over 80%, and that statistic was provided by Rutledge in an article in 2021. Furthermore, those statistics by Rutledge indicate that after COVID-19, about 65% of healthcare users are going to continue to utilize telehealth. So this slide, what are the three top priorities for telehealth? Patient satisfaction, clinical efficacy, and cost. So going forward after the pandemic, there's still many questions that have to be answered. So are the patients going to continue to use telehealth instead of in-person visits? Due to the increased rapidly growing use of telehealth during the pandemic, many providers were not properly trained in the use of technology. So how effective will it be in the long-term use? And as always, cost is a major concern with anything to do with healthcare. The next three slides are going to provide more information regarding those three questions. And this is a graph showing the patient satisfaction with the use of telehealth between March of 2020 and January 2021 by age group. And as you can see, there is a great deal of satisfaction in using telehealth. This slide is depicting how telehealth is going to improve healthcare business. And basically, I've given 5 reasons here. The first one, meeting new mandates and payment models. So again, what are the new regulations that are going to be put in place and how are they going to be applied to the use of telehealth and who's going to cover that? Increasing the market share and retaining current and getting new patients. So that's another way to improve the healthcare business. Healthcare is becoming more consumer driven for sure. and we need to decrease cost. And I think telehealth definitely will provide a decreased cost and increase efficiencies, such as decreasing doctors' travel time to various hospitals and offices. Some examples of positive financial impact of telehealth, again, increasing revenue and decreasing cost. And some other cost improvements that I haven't discussed, the use of electronic medical record, EMR, definitely saves time and money. Having the ability for providers to look at someone's electronic medical record and look at maybe another provider's care can speed up the process of helping our patients get better care. It can also reduce hospitalizations with using telehealth because they can be seen at home, and people are more willing to talk to somebody and not have to travel to the hospital to get treatment. Prescriptions can be written right from a telehealth visit, and increase efficiencies such as allowing providers to see more patients in less time. And in conclusion, the new legislation currently proposed regarding telehealth, Bill H.R. 341, Ensuring Telehealth Expansion Act, that was introduced in January of 2021 by Republican William Rogers, definitely needs to be passed into law to continue the current telehealth expansion and growth that are supporting a very strained medical system. Thank you so much.